Hi, my name is Valerie Shin, nurse practitioner. I'm with hepatology at UCLA Health. These are some of the frequently asked questions from community GI providers in regards to MASLD and MASH, especially about non-invasive tests, NIT. Question: I use V4 score for patients suspected of steatosis. What limitations should providers be aware of? Answer: V4 is typically the first screening NIT due to its simplicity and low cost. It only requires patient's age, platelet, AS, and ALT. There are important limitations to remember. First, some patients with MASH, including those with advanced fibrosis or cirrhosis, may have normal AS and ALT levels, which can result in false negative. Second, age is a component of the V4 formula. Older patients may have higher V4 scores regardless of fibrosis stages, leading to false positive. Third, platelet count is part of formula. When patient has thrombocytopenia, this is unrelated to the liver. V4 score should not be used. Due to these limitations, I often incorporate a second NIT to improve diagnostic accuracy. Question: what are the most common second-line NIT options and what are their limitations I should remember? Answer: the most frequently used NIT for me is transient elastography, such as FibroScan. Number one, it's non-invasive and quick. It provides a result as soon as the test is done, but that's only if we have the machine in the clinic. On the other hand, not every clinic has the machine, is not widely available. FibroScan is very much operator dependent and requires a properly trained technician for accuracy. It may also be less accurate when the patient's BMI is higher than 30 or if there's increased subcutaneous fat. FibroScan can also falsely elevate liver stiffness measurement when there is an acute inflammation, cholestasis, hepatic congestion, or ascites. I also use ELF score. When FibroScan is not available, the ELF blood test is another option. ELF score should not be used in patients with non-liver fibrosis, such as pulmonary fibrosis. The biomarkers used for this test can falsely detect non-liver fibrosis. The result will provide false positive result. The ELF score result may take a few days to return, making it less suitable for rapid clinical decision-making. Sometimes ELF score is not reimbursed by insurance, something to consider. I like MR elastography too. It is most accurate NIT, but it is the most expensive NIT at the same time, and not every clinic has it. The test takes a long time since it uses MRI machine, is not suitable for patients with claustrophobia, severe obesity, or with non-MRI compatible metal implants. Question: is the liver biopsy still considered necessary? Answer: liver biopsy is now rarely used for staging of a liver fibrosis for MASLD and MASH, but it remains helpful when NITs provide conflicting or inconclusive results. It's typically reserved for complex cases or when diagnostic clarity is essential for managing decisions. So we briefly talked about the limitations of NITs today that are frequently asked from community GI providers. I hope this was helpful. Thank you very much for listening. Feel free to contact us if you have any questions on this topic.